Okay, so here we're looking at a pig heart, and I'm going to go ahead and rotate the pig heart for you. Okay. Rotisserie pig heart here, and I'm going to stop right there, and I want you guys to tell me, does that look like the if you had to guess, would you tell me that that's the anterior or posterior side of the heart, the front or the back? And the answer is that it's the anterior side. It's got a nice clean surface here. If you look at the posterior side, okay, there's a lot of vessels and a lot of stuff going on here. And most of the vesselage that enters and exits the heart does so on the posterior side. So you get all that vesselage, and then you get all that connective tissue around there too. Okay, so now we're back to the anterior side. And if on the lab exam I were to take a pin and point it in that structure right there, what would you tell me, what part of the heart is that? And the answer is the apex. So that's the apex of the heart. And that makes this area up here the base. It's basically like an upside down mountain where you have the base down below and then the apex up top. All right, so let's look some more at the heart here, the anterior side. We have this blood vessel running right down like so, conspicuously right down, kind of crossing right down through the heart here. Anybody know what that artery is? And I'll give you a hint. It's part of the coronary circulation, the part of the circulation that feeds the heart itself. This is the anterior interventricular artery. Anterior because it's on the anterior side of the heart, and interventricular because it separates the ventricles. This whole area here, that's ventricle. Okay, and this separates the right from the left. So if I were to take a pin on the exam and I were to poke it through there and I were to ask you which heart chamber that pin is poking through, what would you guys tell me? And the answer would be the right ventricle. Right ventricle, left ventricle. Now, what else here? Okay, what about the atria? Where are the atria at? Well, a good distinguishing marker for the atria are these wrinkled appendages here called the auricles. This is the right auricle, and this is the left auricle over here. Left auricle. And basically, these are appendages that are attached to the atrium. The atria are right below it. So the left atria would be about there. The right atria would be about there. And these auricles here, they do increase the volume of the atria a little bit. So blood can get up there, and it does increase the volume of the atria. Now let's open it up. But before we do, we want to have an idea what we're looking at inside. So keep in mind that right underneath that point there, that's going to be the left ventricle. So let's open it up. And here we go. Think that'll work. Okay, so let's first of all, I was poking right there before, so we think, all right, that's possibly the left ventricle right there. Okay, and we'll come back to that. What about this structure right here, this big meaty structure running right down the middle? That is the interventricular septum, and it separates the right side of the heart from the left side of the heart. Okay, so back to this and where we think this left ventricle is. Let's look at some more things. What's that structure right there? Slide it out here. These structures right there. Those are your heartstrings. Those are chordae tendineae. And chordae tendineae are anchored to two things. Down in the left ventricle here, what are those chordae tendineae anchored to? They're anchored to papillary muscles. And you have this odd kind of nipple-shaped muscle down here that are the papillary muscles. And you can see the chordae tendineae that attach right to those. So again, the presence of papillary muscles in the chordae tendineae anchored to those lets you know that you're looking at a ventricle here. So what else does do the chordae tendineae attach to? They attach to valves, specifically atrioventricular valves. So I can take this hemostat and grab the valve, and this thin piece of tissue that I'm looking at there, that is the left atrioventricular valve, the mitral or bicuspid valve. Let me see if I can do this here. So this runs over like so. All right. So let me get that out of the way. So here's the left AV valve, and what does that make this chamber up there? That's the left atrium. So what's going to happen is blood's going to flow from the left atrium through the left AV valve down here into the left ventricle. So this is the left ventricle right here. Now what's going to happen is what happens when the ventricle contracts. So the ventricle contracts, and it's got to squeeze that blood out of the left ventricle, and as you guys know, it's going to go into the aorta. So when it contracts, this left AV valve is going to shut, so blood does not get back up there into the left atrium. And instead, it's going to take this route out of the heart. And if you take your probe and stick it up through that route, okay, stick it up through there, and that's where blood exits right there. That takes you out the top. Specifically, it takes you out the aorta. So that's the aorta up top. And if you go back here and you follow this path that the blood takes out of the left ventricle into the aorta, then it'll also help you find the the aortic valve. So the aortic valve is somewhere in there, and I'll let you guys look for that. And what you guys are looking for is valve tissue. Okay, it's flap-like tissue, and it doesn't have the chordae tendineae on it. Okay, so it's just flat valve flap tissue. All right, and then we can look at the right side of the heart, and this is the right side of the heart over here, and it's a little tighter. But you should know that the amount of blood that goes out of the left ventricle and the right ventricle with each heartbeat is the same. Okay, so they're shooting out the same amount of blood. But if we take a look inside here, okay, there's kind of a lot going on, like I said, and I don't know if the cameras can pick this up, but I'm looking in there and I'm just looking for familiar stuff.